Good afternoon, everyone, and thank you for joining. My name is Andrew Fox. I'm a Senior Growth Lead here at PatientPing's Payer Growth Team, and I'm thrilled to welcome you all to our webinar today, CMS Star Ratings Program, Preparing for New Measures and How to Succeed. As you may know, CMS recently released the 2021 Medicare Advantage Advance Notice and Technical Changes, which includes updates to the Medicare Advantage Star Ratings Program impacting health plans. Beginning in measurement year 2021, two additional HEDIS measures will be included for STAR scoring: transitions of care and follow-up after ED visit for people with multiple chronic conditions. Today, our team will be discussing these two new measures in detail and how organizations can succeed and meet all requirements included within them. Before we dive into today's conversation, I'll be covering a few technical logistics. First, attendees will remain muted throughout the webinar. We will have a Q&A portion at the end where you will be able to submit any questions via the GoToWebinar control panel by clicking the question mark icon on the right-hand side. We will try to answer as many questions as possible, but if we can't get to all of them, we will follow up with any of you whose questions were missed. A copy of the webinar recording will be sent to all of you shortly after the session, as well as a copy of the presentation deck as well. With that said, I'm pleased to introduce our two speakers today, Molly Kane and Deb Daly. Molly is PatientPing's Health Plan Strategic Accounts Manager. Prior to her time at PatientPing, Molly worked in payer policy at Athena Health, where she led the regulatory review of CMS proposed and final rules and coordinated Athena's operational response to payer and industry changes. Molly holds a degree in government and legal studies from Bowdoin College. And Deb is on our Health Plan Solutions team here at PatientPing, leading onboarding and optimization for health plans. Prior to PatientPing, Deb held roles at MassHealth, Massachusetts Medicaid Agency, focusing on the state's strategy for dual eligibles and behavioral health. Deb has a degree in public policy from Princeton University. And with that, Molly, I'll turn it over to you.
Great, thanks, Andrew. And so, as Andrew mentioned, the goals for today's webinar are to provide context for the 2021 Star Ratings performance year, to give a detailed overview of the two new STARS measures, to highlight key considerations for ensuring your plan's success at these measures, and then to review how plans can leverage real-time data to support performance improvement. So before we dive in, we'll start with a 10,000-foot overview of the Medicare Advantage Part C Star Ratings program, and I'm sure many of you are very familiar with STARS already. But essentially, the STARS rating program is intended to rate the quality of member care and experience provided by a Medicare Advantage plan. And the program rates plans at the Medicare contract level on a 5-star scale across many measures, typically derived from HEDIS, CAHPS, and HOS measure sets. These measures are divided into 5 domains to represent different aspects of member health and experience. We have staying healthy, managing chronic conditions, member experience, member complaints and changes in plan performance, and health plan customer service. And at the end of the day, STAR ratings can impact your plans in a few ways. So first, STARS directly impacts the revenue in the form of your quality bonus payments. So for up to 5% of your county Medicare Advantage capitation benchmark, as well as your rebate percentage for plans bidding below the county benchmark. And beyond these direct revenue implications, STARS can also impact your marketing activities, your member enrollment and market share, all of which have downstream implications for your member risk profile. So as a part of CMS's release in February, there were several updates to the STAR ratings program, including the addition of 2 measures in the managing chronic conditions domain. And so with these 2 measures being transitions of care and follow-up after ED visit for people with multiple chronic conditions. But before we jump into a deeper dive on each of these 2 measures, we'll first touch on a few key points that apply across both measures. So first, and Deb, if you could go to the next slide. Thank you. So first, each of these 2 measures pertain to aspects of care coordination after an acute event. And so really generally speaking, the addition of these measures acknowledges that a patient's care journey after an acute event has significant impact on outcomes. And ensuring smooth transitions of care, including follow-up and connection to appropriate resources, can ultimately lead to reduced readmissions, decreased ED recidivism, and increased continuity of care, and now adds to plan STARS performance. So just a few details on the right-hand side here across both measures. So both of these new STARS measures will be measured in 2021 and will be counted towards plans 2023 star rating scores. And both measures are weighted right now at 1 point each, although I would like to note as well that there is potential for the transitions of care measure to be increased to a 3-point weight in future years. And then finally, both measures are also existing HEDIS measures, and they were included as 2020 display measures.
So thanks for that overview, Molly. We'll begin with a deeper dive on the transitions of care measure first, which I'll refer to as the TOC measure as well. So the transitions of care measure is actually a combination of 4 measures, each pertaining to a different component of acute transition. Overall, the TOC measure is the percent of all discharges for which each of the 4 measure components occurred. You can see the 4 measure components on the right-hand side of the screen, and I'll circle back to those in a bit more detail shortly. So the population for the TOC measure is all beneficiaries age 18 plus with continuous enrollment from the date of discharge through 30 days post-discharge. The eligible events counted towards the measure denominator are any acute or non-acute inpatient discharges between January 1 and December 1 of the measurement year. And a few more details on that. If a given member has multiple discharges during this period, all discharges will be counted towards the measure. And in the case of a readmission or direct transfer within 31 days of that initial discharge, the last discharge event in that 31-day period is what's counted. So returning to those 4 measure components, these are notification of inpatient admission, receipt of discharge information, patient engagement after inpatient discharge, and medication reconciliation post-discharge. So now we'll dive into a bit more detail on each of those 4. And so, as I said, each of the 4 components has its kind of own specific measurement criteria. And you may also note that in the 2020 display data, you'll actually see performance reported for each of these specific components, as well as the overall TOC measure itself. So plans should really evaluate your performance in each of the 4 areas, as well as the combination of all 4. And so with that said, we'll review the requirements for each. So beginning with notification of inpatient admission, this component requires documentation in the member's medical record of receipt of notification of the inpatient admission on the day of discharge or the following day. That timeliness standard will be key to note for success here. The notification itself may be in the form of an ADT notification, EMR notification, email, phone, or fax. The next component, receipt of discharge information, also requires documentation in the medical record of receipt of discharge information. The discharge information here generally includes info about the treating provider and procedures done, discharge plan, medications, etc. And again, this must occur on the same day or next day as the discharge itself. Moving to the bottom left, patient engagement after inpatient discharge measures whether the patient had an outpatient, telehealth, or telephone visit with a provider within 30 days of discharge. And last but not least, medication reconciliation post-discharge measures whether MedRec was performed by a prescribing practitioner, clinical pharmacist, or RN within 30 days after discharge.
Great, thanks, Deb. And so moving on to the follow-up after ED visit for patients with multiple chronic conditions. And so this measure is the percentage of all ED visits for which the member had a follow-up service within 7 days of that ED visit. And the population measured here is a bit more specific than that of the transitions of care measure. So for this measure, it includes all beneficiaries ages 18 and older with at least 2 chronic condition diagnoses prior to that ED visit. And these members also have to have had no more than 1 enrollment gap of up to 45 days in the year prior to that ED visit. And as you can see here as well, the denominator for this measure is all ED visits for the population. So now to go into a bit more detail on a few of the measure components, specifically the chronic conditions component, as well as what constitutes an eligible follow-up service. So at least 2 of the chronic conditions or chronic condition categories listed here on the left-hand side must have been recorded as diagnoses during the measure year prior to the ED visit being counted. And as for eligible follow-up visits, as you can see here on the right-hand side, there are a range of services that are accepted, including outpatient visits, telehealth and telephonic visits, several behavioral health services, and observation visits. And all of these may be documented using CPT, HCPCS, or SNOMED codes per the relevant HEDIS value sets.
Great, thanks, Molly. So now that we reviewed the transitions of care and ED follow-up measures, we'll shift gears a little bit and discuss how plans can prepare for the quickly approaching measurement year. We'll begin with a high-level overview and then focus on how timely and actionable event notifications can be used to drive performance improvement. To begin, plans should consider first measuring current performance in these measures, as well as other similar measures, benchmarking your follow-up timeliness and member engagement performance, evaluating the data and tools currently available to you, providing timely and actionable insights that will allow your teams to meet measure timeliness requirements, evaluating your current care management functions and processes, and finally, evaluating your relationship and performance of providers who will have a key role in your plan's success. So as you measure your plan's performance to date and set targets for improvement on these two measures, the 2020 display measure data published by CMS will be a very useful tool. The display measure set contains both the transitions of care and ED follow-up measures, with scoring calculated exactly as will be the case for the performance year 2021. We pulled the average scores across plans for these two measures, and as you can see, the overall transitions of care measure had an average score of 40%. This means that all four components of the measure were met for 40% of all eligible discharges. Taking a closer look at the four components of this measure, you will see that there was a wide range of scores, with the average score for notification of inpatient admission being 16%, receipt of discharge information being 11%, engagement after inpatient discharge at 81%, and medication reconciliation post-discharge at 53%. The wide range of average performance across these four components likely indicates unique challenges for each. Plans should seek to understand your performance and challenges for each individual component, as well as how they stack together to make up your overall transitions of care performance. Turning to the ED follow-up measure, the average score across all plans was 55% in the 2020 display data. This means that members with chronic conditions had a follow-up visit within 7 days of an ED visit 55% of the time. So now turning to the role of timely and actionable event notification data. Given the nature of these two new STARS measures, knowing when your members receive care in real time will be crucial for ensuring consistently high performance. So to give a brief overview of PatientPing, we provide our partner health plans with three core products: pings, or real-time notifications on your members' care events; callouts, which allow you to engage providers at the point of care; and spotlights, which are real-time analytics dashboards. We provide these products to plans across the country, and the real-time data is available for events across our national network of providers, as you can see in the map on the left-hand side of the page. Our network includes 1,000 hospitals, 5,700 post-acutes, including SNFs and home health agencies, and over 300 ACOs or provider organizations. To date, our network captures 43 million patients and has processed over 135 million patient encounters. And so focusing in on those event notifications themselves, or pings as we call them, we provide these notifications via our intuitive web-based platform, as well as through direct integrations and other data delivery methods. The event notifications include ED presentations, admissions, discharges, transfers, and are coupled with historic utilization and encounter detail as well. And again, all of that data is available for all events across our national network. So thinking about how these pings can drive measure and general follow-up performance for your plan in two distinct ways. First, on the left-hand side, pings can drive your care management workflows and influence the point of care as well. So your team will receive real-time notifications of member events, and at the same time, you're able to provide population-level admit and discharge instructions that are visible to providers at the point of care. Second, on the right-hand side, pings also allows you to develop real-time feedback loops to measure your interventions and identify trends. So our data can easily be piped into your existing reporting structures and give new insights into utilization, performance, and facility or regional level trends in real time, which can be compared to a 30 to 90-day claims lag or a similar delay in provider reported data. Now to dive a little bit deeper into how PatientPing can supercharge your care management workflows, and specifically for these two new STARS measures discussed today, we'll briefly walk through some of the actions and pathways that can be triggered by Ping. For example, let's say one of your members presents to the ED. Your team will receive a ping, which should be directed to the appropriate team member and pushed directly to their email inbox. And at that point, the care manager can then coordinate with the ED social worker to provide appropriate member context, assist with identification of lower level care alternatives, and engage the member directly if clinically appropriate. If that member were discharged directly from the ED to home, for example, your team can then re-engage the member to educate them on services and appropriate ED utilization, and more importantly, help schedule a follow-up visit within 7 days of that ED visit for the follow-up measure that we discussed earlier. They can also arrange for any other services needed. Now let's say instead of being discharged from the ED, that member was admitted to inpatient from the ED setting. Your appropriate staff member would receive that notification as well. So they can then engage the inpatient case manager at the hospital to begin working on discharge planning, monitor length of stay for appropriate utilization, and coordinate post-discharge care and ensure all referrals are to specialists and providers, including post-acute, in your network. Finally, your team will also receive a notification when that member discharges from the inpatient setting, and that notification will include discharge disposition as well. So your care manager will then be able to ensure that there's a PCP or other provider visit scheduled with a follow-up. Perform timely post-discharge assessments or any medication reconciliation. Ensure the member is connected to any additional services they might need. And last but not least, close out any open stay authorizations. And so now I'll hand it back over to Molly to tie these workflows to a few other HEDIS measures as well.
Great, thanks, Deb. So in considering real-time data-driven workflows for performance for the newly added STAR measures, it's also helpful to think about how similar workflows can be applied to and benefit other measures at the same time. So outside of STAR ratings, the same real-time member event notifications that PatientPing provides can trigger workflows and drive interventions and timely care for multiple other HEDIS measures, including the ones listed here on the right-hand side. So as you can see, these range from measures focusing on utilization to follow-up measures similar to the ED follow-up measure we reviewed today, to things such as prenatal and postpartum care. Now on the next slide here, perfect. So now really just starting to think beyond quality performance and these specific HEDIS and STAR-related measures. PatientPing's real-time data can also be used more broadly to manage care and costs for Medicare Advantage populations. So some areas where PatientPing can help include those listed on the left-hand side here. So for snowbirds and other out-of-state care, PatientPing notifies plans and providers whenever members receive care anywhere on our national network, including for out-of-state care. So this can range from members seeking care across a state line to traveling to different regions altogether for, say, seasonal travel or to visit a family member. And if you have a member who presents at a facility out of state, our notifications can give you insight into that event and also act as an opportunity to connect with the out-of-state providers treating your member. And on the post-acute facility management side, through real-time notifications, planned care managers can connect with the point of care to guide referrals to preferred post-acute facilities and home health agencies. And on the flip side of that, through PatientPing's data, plans can monitor length of stay both for individual member stays and more broadly as a trend in utilization for the post-acute facilities at which their members receive care. So really helping to better understand post-acute performance in real time and build stronger provider and facility relationships. Now, for new members that your plan may be receiving through enrollment periods, PatientPing's visit histories can provide historical utilization information for these members. And then this, coupled with our intelligent flags, which are able to alert you to things such as any members who are high utilizers or members with 30-day readmission risks, enables you to better risk stratify and care for members on day one before the availability of claims data. And finally, chronic conditions and high-risk cohorts. Through custom program attributions, plans can separately track and manage different segments of their populations, with this information also visible to providers treating your members as additional context. And these programs can include things such as risk groups, chronic condition or disease-specific member cohorts, and any other criteria that are helpful for you as the plan to include. So now just to revisit the two new measures and how real-time member event data ties in directly to performance against them. So beginning with the transitions of care measure and its four components. PatientPing is able to provide a real-time admission notification, or ping, which the provider may receive directly or the health plan can receive and then pass along notice to the provider. For the receipt of discharge information, plans can leverage a real-time discharge ping to track against the timeliness requirement of documentation being completed 1 day post-discharge. This discharge ping can then also trigger the initiation of timely workflows for the patient engagement and MedRec requirements, ensuring they are completed within the 30-day post-discharge timeframe. And on the follow-up after ED visit side, a real-time discharge ping can trigger the timely follow-up workflows. And PatientPing's program attributions can be used to segment out the member populations that fit the multiple chronic condition criteria, better streamlining those workflows. And as we discussed earlier, PatientPing's real-time data also allows health plans to track against key indicators for measure success through real-time feedback loops and visibility into utilization, performance, and other trends ahead of claims data. So this wraps up our presentation portion for today, and I will hand this back over to Andrew to help field any questions that may have come through from the audience.
Great. Thank you, Molly, and thank you, Deb, for the discussion and the overview. Before we jump into the Q&A session, I wanted to point out where you can find some additional resources. To learn more about PatientPing, you can visit www.patientping.com or contact us at connect@patientping.com. And we've also linked to our asset, which outlines further information on the CMS Star Ratings program as well. Now, to help guide the Q&A session, we're going to take a few minutes to launch a quick interactive poll. You should see the poll appear shortly on your screen, and we'll give everybody a couple of minutes to answer the question. Great, thank you, everyone. I think the poll might still be up on some of your screens, but while you're still answering that, I think we are going to dive into the Q&A led by various members of our team. So thanks again to everyone for joining, and we appreciate your feedback on the poll questions there. We've had quite a few questions submitted already, and I encourage any of you who have not yet done so to submit them via the question mark icon on the GoToWebinar control panel. And so with that, we're going to jump into the first question. So somebody asked, what does medical record mean? Are they referring to the payer's system or something else? And Molly, I think you're probably best equipped to answer this one.
Yeah, absolutely. Thanks, Andrew. And this is a great question. And so for the purpose of the measures, the medical record is the outpatient medical record. So a provider's medical record that would be within their EMR. And I did also just want to note for this too, that if a patient has multiple providers and multiple medical records, the medical record used should be the one from their most recent PCP or other ongoing care provider. So if they've seen multiple providers or PCPs during the measurement period, it should be the one who has engaged in patient care most recently within the outpatient setting.
Great, thanks, Molly. And this next question, Deb, I think you might be best answering this one. So the question was, can you share any best practices for ED follow-up or initiating actions after inpatient discharge?
Sure. So we definitely have a range of best practices for ED follow-up specifically, as well as inpatient follow-up and other event types as well. And so at a high level, our framework for success in ED follow-up is to first always baseline your current performance and set clear goals for improvement. So this can be done using the 2020 HEDIS display and measure results, as well as any internal reporting and analytics on both claims and process measures, that you have. And then after that, really identifying gaps in your existing resources and workflows. So are your teams receiving information on ED and inpatient discharges in a timely manner? And if so, are there clear and consistent workflows to act on those notifications? And so as you look to streamline your team's follow-up workflows, in the PatientPing platform, you're actually able to set up push notifications to your team's emails or text for key subsets of member events. So for example, if one of your care managers is responsible for all events at a specific hospital, we can set up those notifications to be person specific. And to be even more pointed, I would say our key best practices are first ensuring that you have a clear answer for the question, who's on first? And second, ensuring that your staff receive timely and clear data in a manner that's not overwhelming or resulting in notification fatigue. And so last but not least, it's always important to measure your progress in real time. So while HEDIS measures are based on claims data, you can use a combination of the real-time notification data and process measures as a proxy for your real-time performance. So that allows you to kind of always keep tabs on how your performance is trending and make adjustments along the way.
Great, thanks, Deb. The next question, and wouldn't an HIE or other ADT vendor be able to provide the same data as PatientPing as well? So for the first part, while getting important data and clinical information on your members from either a provider's EMR or a health system hospital EMR is certainly valuable, we have found and we've been told that it's often not comprehensive enough. Meaning you may only get this data from health systems that you have key partnerships with or provider groups that you have formal contracts with. And these methods tend to be more of a find and retrieve rather than a real-time push notification that PatientPing offers. So however, this information is great. We often find and are told that it does leave coverage gaps when thinking about being notified in real time on your members' activity, especially considering the full continuum of places they may be seeking treatment, whether that's other health systems that you don't have formal relationships with, out-of-state health systems, providers that you're not in formal agreements with, and then certainly when thinking about the transition of care side of things, the post-acute space as well often is a big gap. And then somewhat of a similar story for HIEs and other ADT vendors is they often are not offering the full picture in a real-time manner that's pushed to you at the time and during your member is experiencing these events. HIEs sometimes provide just a daily or kind of a summary file every 24 hours. So it's not true real-time notification, and it may be more of a find and retrieve. Again, you're going to have to query information on your member events to understand what's going on, rather than getting a true real-time push notification. In addition, HIEs often are somewhat limited in their participation, right? So you're only getting the data from those who participate and contribute to the HIE. So typically out-of-state information is not going to be available in that HIE find and retrieve query, and post-acute space usually is a big gap for HIEs. They often don't include or have participating post-acute data, which is obviously critical information when considering the transitions of care measure. And then taking a step back, thinking more about the user experience and the technology side of things, HIEs often offers a variety of methods to digest and receive this information to best suit you and your team's needs and workflow. So whether that's getting the information on our web-based application, getting it via mobile device, getting the information actually integrated via an HL7 integration into potentially a system or a care management platform. All of these kind of separate PatientPing from HIEs and other vendors. And then finally, PatientPing really creates more of a communication and collaboration in the community. So rather than just tapping into an HIE and doing a query to find this information, you're actually receiving real-time notifications from the community via PatientPing, but you're also then able to push information back out into the community as well. So being able to better assist your community partners, improving outcomes, while also having the ability to actually work with PatientPing to downstream these notifications to your provider partners. The next question, Molly, I think this one will be for you. For the transitions of care measure, you mentioned that notification of admission and receipt of discharge had to be documented in the member's medical record. Does that mean the notification must go to the member's provider?
Yeah, absolutely. I can take this one. And yeah, so this actually ties in a little bit to the previous question we had received on medical records as well. So this notification of admission and the receipt of discharge info must go to that member's PCP or the other ongoing provider, and then has to be documented within that outpatient medical record. But that being said, the notification can also be routed from the health plan to the member, to the provider. So for example, if one of your members is admitted to the hospital, you as the plan can receive that admission notification, but then it will still be counted for measure performance if you then pass along that notification to the provider, who then documents it within the medical record.
Great, thanks, Molly. The next question, I'll take this one. So a successful follow-up visit for ED follow-up or TOC engagement measurements requires that the member to attend a visit with a provider. Even if I have this real-time data, the member's providers likely don't know about the ED visit or inpatient admission. Can providers get this real-time data too? So the simple and short answer is yes. PatientPing works with a wide range of provider organizations to provide this same real-time data. So in the same manner that your health plan can be tapping into this real-time database and receiving these real-time notifications, provider organizations, primary care practices, they can all be participating and receiving these real-time notifications as well. In addition to this, PatientPing also has a solution called provider enablement. So we actually work with health plans, and this is an option that they can take advantage of, in which we will work with you to ensure that your members' attributed providers are receiving notifications on their events. So essentially, we're working with you to understand which providers in your community are important and a part of your network, and then we're downstreaming those notifications to them so that they're actually receiving those same type of notifications that you all are getting as well. And then another question came in: do you end up getting a lot of duplicate notifications? So I'll answer this one, but Molly or Deb, definitely feel free to jump in if you have anything to add here. I think the simple answer here is no. So the way that PatientPing works is a health plan is uploading a member eligibility file into our database, and it's often that you are receiving these real-time notifications as your member is moving through this process and kind of experiencing these transitions of care. We have a proprietary matching algorithm where we are bumping up your eligibility file against hospital ADT feeds and post-acute census to create these real-time notifications and push those out to you all and your teams and your end users. There are 5 different types of notifications we can send. They are presented, admitted, transferred, discharged, and deceased. So in terms of duplicative notifications, you won't get duplicative notifications, but you may get a presented notification for a member, and then an admitted notification for a member, and then a discharge notification. But these are being updated in true real time as the member is moving through that process. I think we have one more question here before we wrap up. Is transitions of care a one-weighted measure that averages the rate of the 4 subcomponents, or is the overall star rate the rate of members who have gotten compliance for all 4 subcomponents? And Molly, I think you'll take this one.
Yeah, absolutely. Another great question. And so for the transitions of care measure, it is the second option there. So the overall star measure score will be the rate of members who have received compliance for all of those 4 subcomponents. So really, you can think of it as an all or nothing measure where for each of those individual member discharges, you have to check off all 4 of the criteria in order to be scored the point for this measure.
Great, thanks, Molly, appreciate it. So without any further questions, this concludes our webinar. Thank you all so much for your participation today. And as a reminder, you will receive a copy of the presentation and slides from our team shortly after the webinar concludes. And please don't hesitate to reach out if you have any further questions. Thank you all again so much.